Good afternoon, everyone, and welcome to this joyous occasion that we have been looking forward for so long. My name is Dr. Anna Fall. I am the Executive Director of the UFL Traeger Institute Republic Bank Foundation Optimal Aging Clinic. The Traeger Institute was founded with the goal of transforming the way we think about aging and providing care for older adults. We treat this stage of life as an opportunity for people to flourish and being thankful for any additional day to live a meaningful life. Over the years, we have expanded these efforts by incorporating lifestyle and wellness classes like Tai Chi, yoga, and art, and also developing workforce training for interdisciplinary healthcare teams across the state to educate them on age-friendly practices and interdisciplinary collaboration that improve care for older adults. Recently, we have secured a third round of our Geriatric Workforce Enhancement Program funds from the Health Resources Services Administration for a total of $5 million. This program helps us to train the workforce in age-friendly care that focuses on what matters most to older adults. We also were selected by CMS to participate in the GUIDE program that aims to support people with dementia and their unpaid caregivers. We've come a long way since opening our facility in the midst of the COVID-19 pandemic, and today marks a very important milestone in the Institute's history. It is my pleasure to introduce you to a project we've worked hard on to realize over the past few years, our Culinary Medicine Kitchen. The kitchen was inspired by our commitment to educating both healthcare professionals and the public on the merits of lifestyle medicine, which allow patients to have agency over their healthcare by incorporating healthy eating habits that can make a significant difference in preventing and treating health issues. We all have heard food is medicine, and research has proven this to be true. Nutrition is foundational to our overall health, yet it is not always emphasized in provider-patient interactions, nor is it required in many medical school curriculums. As part of the School of Medicine, we will join 60 other medical schools using the American College of Culinary Medicine curriculum and help lead the way to a more holistic approach to health. We're very excited to have medical students start the first culinary medicine class this fall. We couldn't have made this dream real without the support of the university and generous donations from Deborah Krupp, the Patterson family, and GE Appliances. Their contributions made the Culinary Medicine Kitchen possible. We are also extremely happy today to have President Gary Bradley here to be part of launching this initiative that is important not only for the Traeger Institute, but for the university as well. President Bradley, thank you for joining us.
Thank you so much. Thank you, Dr. Fall. Thank you, Dr. Fall. Thank you, all of you, for being here today. You know, Hippocrates, the ancient Greek physician considered the father of medicine, emphasized the importance of diet and lifestyle in maintaining good health. Fun fact, he lived from 460 to 370 BC. That's a long time ago. And as scientists and healthcare providers, and as a society, we're still exploring the full wisdom of that attitude and statement. I don't think people will be considering my statements 3,000 years from now. But culinary medicine is a growing field that integrates nutrition science with practical food preparation skills that can lead to improved health, including better management and prevention of chronic illnesses such as diabetes and heart disease, diseases that affect many older adults throughout our nation. We are very excited about the opening of the Culinary Medicine Kitchen here at the Traeger Institute, which marks a significant advance in the teaching of culinary medicine at the University of Louisville. In this kitchen, the U of L School of Medicine will train healthcare professionals to understand and communicate the impact of good nutrition on their patients' health. Students and faculty members in the U of L Schools of Medicine, Public Health and Information Sciences, Nursing, Social Work, and others will learn more about the role of nutrition in their patients' health, along with techniques for improving food choices and preparation. They will also gain skills to share the knowledge with their patients to enable them to improve their own health through food that they themselves prepare. This kitchen has been a vision of the Traeger Institute leaders for many years, and we at the university are so pleased that it has finally come to fruition, and because of partners, and proud to lead this effort in the greater Louisville and beyond. We're extremely grateful to GE Appliances, a hire company, for donating the state-of-the-art appliances, again, that furnish this beautiful kitchen. This wonderful educational venue is an outstanding example of our dedication to advancing medical education along with community health, reinforcing our role as a leader in integrating innovative practices into healthcare training. It also highlights the Traeger Institute's distinctive approach and dedication to ensuring that older adults across Kentucky receive the care and support that they deserve with dignity and compassion. The Culinary Medicine Kitchen is only the newest element of the exciting work being done at the Traeger Institute, which is truly unique. The Republic Bank Foundation Optimal Aging Clinic here at the Institute offers older adults the specialized health care and lifestyle services that allow them to flourish as they age. And I'm getting older too, so I'm thinking of myself here. The Traeger Institute is advancing this philosophy by teaching the innovative skills and knowledge in caring for older adults. They have developed healthcare providers at every level, as well as supporting family members and caregivers. In support of that work, the $5 million grant for workforce development mentioned by Dr. Fall will further improve access to quality healthcare and support services for older adults, especially in underserved and rural areas in Kentucky. This funding, the third consecutive grant from the Health Resources and Services Administration to the Geriatric Workforce Enhancement Program, is supporting the creation of Flourish Care Centers of Excellence in the Kentuckiana, Cumberland Valley, and Barren River regions of Kentucky. These centers help ensure that healthcare professionals can obtain the specialized knowledge they need to care for older adults and help them remain independent, maintain their dignity, and improve their overall well-being. The University of Louisville is committed to improving the lives of older adults across our nation, our region, and city. The innovation, research, and dedication of the leaders at the Traeger Institute to improving care for older adults and their caregivers is a great source of pride for U of L and a tremendous asset for the city of Louisville. So now it gives me great pleasure to welcome Metro Louisville Mayor Greg Greenberg. Greg?
Thank you so much, President Bradley, and you are 100% right. This is a great new addition, a great asset for the city of Louisville. I'm so excited to be here to celebrate with my friends at U of L for several reasons. One, I'm a firm believer personally in everything that you have just heard of from Dr. Fall, from President Bradley, about the power of food and food being truly medicine. I know from personal experiences, having changed my diet over the years, what a positive impact it can make on your life. And I try to continue to keep that evolution going. And also to be a part of this that's happening right here in the heart of downtown Louisville. To have this new amazing kitchen and the leading edge of medical science, teaching our next generation of physicians is so wonderful to be right here in downtown. And U of L plays such an important role in so many of the exciting things that are happening right now in downtown Louisville. Several of us were just together when we broke ground on the new LouMed Commons that U of L and U of L Health are part of to improve this entire LouMed district, to make it a world-class campus for medical education, research, and patients. Just a week or so ago, we were also another part of downtown Louisville with the Traeger Microforest that's part of the U of L Christina Lee Brown Envirome Institute, and what that is doing to help revitalize downtown with focus on greenery and safe, quality spaces. And there is so much more that is happening in large part because of U of L and U of L Health that I know are just getting started with some of their very ambitious plans here in downtown. And so now to have this addition here at the Traeger Institute is incredibly wonderful. I love that U of L is such a large part of this community and something that's helping us drive the academic growth, the economic development growth. So much part of our growth and development as a city can be attributed to U of L, to their faculty members, their researchers, their students, and what those students are going to do in years to come. And to have this new kitchen here, thanks to our local company, GE Appliances, and all of the other supporters, is really interesting. It is a win for everyone. So congratulations to everyone with U of L. I'm so glad you all continue to invest in downtown Louisville. It is wonderful to see you all on the cutting edge of research, development, and medicine, and I'm happy to continue to support you in all of these efforts. And it's my pleasure to introduce next the CEO of U of L Health and U of L Physicians, Wade Mitzel. Wade?
It is such an honor to be here today, and in 2019, U of L Physicians had around 840 providers. We were in 83 locations. And since 2019, this clinic opened as our innovation hub, where we challenged each other to try to improve healthcare, to make things better. And since then, we have grown to 260 locations throughout this area and 1,450 providers, where we will continue to create stronger, healthier communities. The opening of the Culinary Kitchen here at the Institute is a testimony to that innovation, launched to ensure quality, whole health care to our patients. One of the innovations we are proud of is our Brain Clinic, that is a service to Medicare patients with dementia diagnosis. As part of our Brain Clinic, the Institute was selected after a competitive process as one of only 390 organizations nationally to participate in the Guiding an Improved Dementia Experience, or GUIDE program, for the Centers of Medicaid and Medicare. And this marks a huge step forward for both the Institute and U of L Health in caring for people living with dementia and their caregivers. And it's a testament to the immense work the Traeger Institute of Optimal Aging Clinic has done leading the way in dementia care for our community. The GUIDE program centers around coordinated care that involves a primary care, specialists, and social workers working together to ensure that not only the patients receive high-quality care, but also the caregivers, that they have resources, emotional support to help them navigate the dementia diagnosis. All this is made accessible to those particularly in need by being a no-cost service to those who are eligible. We have with us today a patient, Mary Coomer, who can attest to the impact of the many health and wellness services the Institute provides. Mary?
Thank you, Wade. Thank you. Thank you. I see so many faces here of people who've been so nice to me and helped me so much these last almost 3 years that I've been coming here. A little over 3 years ago, I had a new hip, a new shoulder, and a new hip in 11 months. And I didn't know what to do with myself. So I heard about Traeger Institute. I would love to tell you the serendipitous way it came into my sphere, but I just don't have time because I want to tell you what all I've done since I've been here. I went to physical therapy. I know that's not technically a part, but I went there. I took Tai Chi. I took yoga. I took art. I went to therapy. I saw the chaplain. They had a chaplain. I could do everything I needed to do right here. And I'm 83 and a half years old. So I think that Traeger Institute has extended my life. It's certainly enriched it. And it's given me a lot of wonderful friends and relationships that I'll always remember. And I just want to express my gratitude and to say that if you know anybody who needs anything, tell them to start here. Thank you.
I cannot end this event without noting, President Bradley, that this is your first official visit to the Traeger Institute since you were appointed as the new president of the University of Louisville. We are so thrilled to have you here and look forward to continuing working with you. Now, in honor of this occasion, we have commissioned a gift made for you. It's an official culinary medicine kitchen apron that has been customized in your honor. It was made by Monica Osborne, who is the mother of one of our staff members. She looked up your biography online and captured your essence in apron form.
Wow, I can't wait to see this.
Here you go.
Oh, thank you so much.
You may want to open
I
it.
better open it and show. My wife will be very interested to see what this is about.
Maybe you can start cooking now.
We'll go back to the grill tonight. All right. I see a shamrock.
Before we close our remarks for the official ribbon cutting, I must recognize and thank those who are sharing their time and talents with us today. First of all, our wonderful piano player, 89-year-old Jean Monteau. He is one of our patrons at the Traeger Institute. Thank you so much for the lovely music. We really appreciated that. Then the beautiful artwork that you see displayed around you was created by the older adults in our painting class, led by our instructor, Connie Weiss. And for anyone interested in ever taking home one of these paintings, all the artwork here will be up for an online auction with winning bids announced during our Gold Standard of Optimal Aging Award ceremony on September 11. All earnings will be used to continue the class. And soon, within 5 minutes, we will be enjoying a tasting menu from Feed Louisville, catered by Zest in our new kitchen. Feed Louisville is a kitchen dedicated to food justice and supporting community partners in feeding the unhoused community and anyone experiencing hunger. Zest, a culinary project of Feed Louisville, focuses on garden-inspired, nutritious food with global flavor profiles. We're grateful and excited to see and try what Chef Rona Kuma has prepared for us today. So now, without further ado, I'm asking people to join me here so that we can cut the ribbon with a very small scissor.
We don't get another take on